The Sabiston 22nd edition is going to be released. And as you know, this is Dr. Divakar from Surgery Clinics, and today in this video we will be discussing about the various anticipated changes in the latest edition of Sabiston. So you must be knowing that books like Sabiston and Schwartz and Bailey and Love get updated every 5 years. And Sabiston was released previously in 2021, and today we have a new update that the 22nd edition of Sabiston is going to be released on September 8th of 2025, and it will hit the Indian market supposedly by September 24th of 2025. And we were expecting Schwartz also to be released this year, but Schwartz I think it will be releasing in the next year. This video is mainly for the surgical postgraduates who are entering surgical residency in the year of 2025 and 2026, because a lot of things has been changed in both the books, and we'll be discussing everything in this video. So what are the major changes in Sabiston 22nd edition and Sabiston 21st edition, and why this book is different from Bailey and Love, and why someone should go through this book. So first thing is that the 22nd edition has a new editor, that is Douglas Taylor, and the 20th and the 21st edition was edited by Courtney M. Townsend. So whenever you have a new editor coming up for a book, there are a lot of things which will be removed, and there are a lot of things which will be coming in, and the way of presentation, everything might change. So Sabiston 22nd edition is definitely, maybe it's not yet released, but when it released we will come to know what are the major changes, but it should have a lot of changes, because as you all know, there are two books in the market, that is the Bailey and Love and the Sabiston, which are totally different. So Bailey and Love is written by authors based on their expert opinions. It doesn't have too many references and not much of evidence-based medicine also. But when it comes to Sabiston, Sabiston is a book which is completely written on the grounds of evidence-based medicine with a lot of references. So here previously the last edition had 13 sections and 74 chapters. Now we have 11 sections and 121 chapters. So 121 chapters is like almost 40 chapters are new. So that means maybe there is a lot of changes. So in this video I'll just go through like basic things which are different, and why this book will stand alone as a single book for your preparation. Because see, it's not possible to read 2-3 books, because the guidelines are also different and also the opinions will differ. So you will not be able to come to one conclusion. The UK school of thought is incorporated in the Bailey and Love, and the US school of thought is incorporated into the Sabiston. So here if you see the basic surgical principles, previously we were having the inflammatory response, shock, metabolism, wound healing, all these things in the first chapter. Right now these chapters have been moved as a part of trauma and critical care, and rather you have unattractive topics like the COVID era, the competence of a surgeon, and telehealth in surgery, global surgery, ethics and professionalism, ergonomics, all this new quality control, all these new topics which are unattractive has come into the first chapter. As you know, these are the chapters which are not so interesting to read. So we'll see how it's when the book releases. Second thing, in the perioperative management, this chapter in the previous edition was very volatile. It had too many scorings, too many tables, too many information clubbed together, and if you see, people will say for general surgery basics go through the Bailey and Love. But in the latest edition, perioperative care is beautifully written, because you have perioperative management, then anesthesiologic principles, optimizing patient, then ERAs, wound healing, SSI, surgery in geriatric patients, complications, pregnant patients, and also palliative care, and finally basics of electrosurgery and electronics. So I think the perioperative management is written beautifully here. The next one is the trauma and critical care. Trauma and critical care, as I already said, they have included the inflammatory response, shock, metabolism, and also all the trauma topics have been included here, that is a vascular trauma, urologic trauma, musculoskeletal trauma, neurologic trauma, and pediatric trauma. So all the things for the trauma has been incorporated to a single chapter, which makes it easy for reading. And other topics like chronic wounds and also the soft tissue infections are new in this book. So transplant surgery, in the 22nd edition of transplant surgery section in the Sabiston, you have a lot of new topics. As you can see here, you have heart transplantation, lung transplantation, soft tissue transplantation, eyelid transplantation. So how to work up with a patient of transplant and transplant immunology, all this has been kept in a single section. And this is definitely a great way of writing transplant surgery, because the Bailey and Lowe 20th edition update also had transplant in detail. So but the Sabiston 22nd edition is going one step further and bringing great details into transplant. So surgical oncology is one section where they have clubbed the head and neck surgery and breast surgery, and you should know that there is a topic of plastic surgery consideration in cancer surgery. And you must be knowing, in the table of contents in the website they have mentioned that there is no chapter for plastic surgery separately. So plastic surgery is combined along with oncosurgery, and I am not sure why they put up the spleen as a part of this, but you have topics like the peritoneal malignancies and lymphadenopathy also. So surgical oncology, this section of surgical oncology will be very useful for those students who are preparing for the institute examinations, because you have all the malignancies together except the GI malignancies. So head and neck, it has been shifted to the oncology, and breast surgery is also shifted to the oncology. Finally, endocrine surgery is one section which does not have many changes, and they just added neuroendocrine tumors on single topic here. And the esophagus, benign and malignant esophagus, has been shifted to the GA section, and you have a new topic or a section in the name of ventral hernias and inguinal hernias. So hernia surgery is going to be dealt here. And GA system, you have new topics for esophageal cancer, you have new topics for secondaries of the liver, and then for the pancreatic cancer. Rest all remains the same. As you all know, this Sabiston 21st edition has a very beautiful description of the GA system, and I suppose they have maintained the same thing in this edition also. In CTVS, you know, CTVS and vascular is two things. In the old edition of Sabiston was written with huge detail and too much of incoherent way. So many people find it difficult to read these sections, but here they have devised our section well, and they added pulmonary embolism, percutaneous heart procedures in an ECMO, and in vascular they have added new topics for carotid disease, hemostasis, and then for the dialysis access and extremity amputations and visceral ischemic syndromes. So coming to the last, that is the super specialty topics, that chapter of neurosurgery is not existent in the table of contents. So when the book releases, we will know whether elective neurosurgery is dealt in this book or not, but there is a topic for emergencies of neurosurgery in the trauma chapter. So second thing is plastic surgery, basic general plastic surgery also is not mentioned. So the plastic surgery consideration in cancer surgery has been clubbed along with surgical oncology. So other chapters has been maintained, that is the pediatric surgery, maternal-fetal surgery, hand surgery, gynecology surgery, urology surgery. So basic difference is that due to the inclusion of too many chapters, this book will definitely look different from the Sabiston 21st edition. So those students who are entering surgical residency in 2025 or 2026, it is good that they directly buy the Sabiston latest edition and start reading it whenever they find time. And also, as I said, the Sabiston is always a evidence-based medicine based book where they try to put up new studies, trials, and also new findings, and these books will of course it will stay updated for the next 4-5 years. So these are the major changes that we can expect in this latest edition of Sabiston. I am excited about this book, even though if many students have gone into the super specialty, still people love to read books like Sabiston and Bailey. And here are other new books which has been released in this year, that is the Shackelford 9th edition, which is released on the July of 2025, and Campbell 13th edition is also released April 21 of 2025. Thank you. Kindly follow Surgery Clinics on Instagram. We have post updates regarding the examination counselings and also the latest questions and the changes. Also we are coming up with an application for the NEET PG, next FMG and the INACT surgery topics. So stay tuned, please subscribe, and thank you for supporting.